Assessment of Respirations by Brienne Leary.
The next thing you want to assess for is the respiratory rate. This can be done simply by watching your patient breathe. What you want to do is count for a minimum of 30 seconds to see how many breaths the patient takes. It is very important to count for this long because infants and children often have some variation in their respiratory pattern, and if you don't count long enough, you may end up with an inaccurate respiratory rate. The normal rates for patients should be as follows. In newborns, you can expect the baby to breathe between 30 and 60 breaths a minute. For young children, it should be about 20 to 40 breaths per minute. In an older child, anything from 15 to 25 breaths per minute is acceptable. In the adult patient, 12 to 20 breaths should be expected. The next thing you want to assess is whether or not that breathing pattern is regular or irregular. Do you see the patient breathe at a nice, steady rate, even if it is fast, or are they taking very quick breaths and then having pauses in their breathing? These are important to note. In many normal pediatric patients, there is some variation in their respiratory pattern. However, if the patient is taking very quick breaths and then all of a sudden stops or slows way down and the breathing rate picks back up again, this can be a very ominous sign of impending respiratory failure. In addition, in a baby or a small child who is breathing too slow, that can also indicate that a child is experiencing respiratory distress and soon-to-be failure.